Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
How will you describe this? Yes, guys, I'm waiting. Yes, Deba, very good. Very good. Excellent. Aqueductal stenosis is a question, is a thing which is expected of you, but not a very common thing. So if you know it, very good. Very good. Excellent answers now. Very good. Very good. I just don't want anencephaly. Anybody can identify it as anencephaly. I'm questioning is why. How will you describe this specimen? Okay. You will describe this specimen in toto. Everything that you can see over here, you will describe. The most, startling fact will be the first one. The abnormality will be the first one, and then you can describe the remaining. The remaining body is probably showing preservation changes. It is yellowish because of being kept in formalin, and grossly the body looks. Grossly the body looks structurally okay. The head looks malformed with so and so. The first leading statement should be, how is the head looking? Okay. Absent cranial vault with frog eye appearance. Excellent. Very good. Excellent. Very good answers this time. So this, actually, it's not the image, I'll say. The specimen is preserved anencephalic fetus stored in formalin. This this I'm going to skip because that's not the right way to start. The cranial vault is missing. Okay, this is a specimen of a fetus. Let me start with this. Let me just start with this. This is a specimen of a fetus with cranial vault missing. Okay, there are certain cranial features exposing the undeveloped brain tissue. Okay, eyes appear large and bulging. The nasal bridge is flattened, giving a distinct facial appearance. Mouth appears slightly open and the lips also seem underdeveloped. Ears are abnormally positioned due to lack of skull formation. Head appears small with an abrupt end at the forehead. Prominent orbital ridges which further emphasize the bulging eyes. Spine appears, spine I'll not say because you can't see over here. Limb appears normal, but in some cases there could be joints, and due to reduced fetal movement, that is okay. Umbilical cord remnant is also visible at the lower abdomen. This looks like a specimen of anencephalic fetus. Okay, preserved specimen of anencephalic fetus. All because these certain other changes are because of the preservation. So this looks like a preserved specimen of anencephalic fetus. You are saying this after you've said everything. Okay. So did you see that I also described the body features? Okay. The ears are abnormally positioned. Head appears small. Prominent orbital ridges. The joints are looking small because of the reduced fetal movement. Umbilical cord remnant is also available, and there is also a scar mark, if you can see over here. Probably, I don't know, because of is this just a artifact, or is it's look like a suture line? But this is a full grown fetus, right? This is not a very small fetus, so most probably it was a post-mortem, but you don't really need to do that because it's an anencephalic baby. It will not survive anyways. Okay, anyways, so this could be the reason of the suturing, probably the midline scar. But yes, this is how you will describe that this is a specimen of a fetus with the cranial vault missing. The eyes appear large and bulging. Nasal bridge is flattened. Mouth appears slightly open. Lips are underdeveloped. Ears are abnormally positioned. Prominent orbital ridges. And umbilical cord is remnant. Looks like a preserved specimen of anencephalic fetus. The pathophysiology behind this is that there is a failure of the neural tube. Just a minute, guys. Anencephaly occurs due to the failure of the neural tube to close at the rostral, that is the cranial end, during the 3rd and 4th week of gestation, that early on, okay? And that leads to the absence of the forebrain, the absence of cerebrum, preventing any higher cognitive functions. There is a failure of skull bone formation, causing a brain exposure and slightly degeneration because of the direct contact with the amniotic fluid. Brainstem may be partially intact, allowing just basic reflexes, but no higher neurological functions. Such babies do not survive. Let me tell you that. No matter how long you keep them in the fetus, they'll keep growing, but they will not survive till the end. So it's not compatible with life, right? Results in the stillbirth or death within hours or days. It'll keep growing. It'll keep growing till the end. So heartbeat will stay, but it can, die anytime in the womb or immediately after the birth. Folic acid deficiency is the most important deficiency. Maternal diabetes, genetic predisposition. Ultrasound at 11 to 14 weeks usually will tell you that this is absent skull and absent brain, and you want to prevent it, just take folic acid. If a patient had a history of previous anencephalic baby, then in that case, you have to give her high dose folic acid supplementation, which is 5 milligram. Otherwise, the normal basic folic acid that you give to everybody, that is 400 microgram, that you will supplement. If you're having folic acid, most probably this is not a problem that can happen to you. Okay, so just an easy few questions. What is the primary cause? It is just the failure of the neural tube closure during early embryonic development. Which structure fails to close? It's the rostral cranial neuropore to prevent the proper brain and skull formation. Why do anencephalic fetuses have bulging eyes? Because of the absence, of the entire this area the frontal bone is not properly formed. Is it compatible with life? No, it is not compatible with life. They die. And how can it be prevented? By taking folic acid before conception. At least 2 to 3 months before conception. Guys, any question, anything you want to add, let me know right now.